Welcome to your 2014 Open Enrollment. This is a time for you to review your benefits and make changes. It begins on March 16th and ends April 15th. In this presentation, I'll go over what's new and the basics of your plan options. The good news is that if you earned 500 wellness points by the end of March, you'll qualify for the discounted medical plan contributions. This $25 monthly discount helps keep your contributions at the same rate as they were at last year. Way to go. Let's see what else is in store.
What's new this year? Not much. The emergency room copay is increasing to $300 from $200. In all plans, generic cholesterol medications will be available at no charge if ordered through Cigna Home Delivery. There are a few changes to the pharmacy network. And now, due to new federal regulations, up to $500 of your healthcare flexible spending account dollars will be rolled over into the next year if you don't spend it by April 30th. This is an active enrollment. That means you must re-enroll in the medical plan of your choice, or you will be defaulted into the Cigna Open Access Plan, which has the largest network but highest contributions of the three plans. If you previously waived coverage, your status remains in effect. There are no dental or vision plan changes, and you do not need to re-enroll unless you want to make a change. You can enroll or make changes to your medical, dental, vision, or supplemental plan. You can add or drop dependents, and you can enroll in the HFSA. You will also be prompted to update your life insurance beneficiary. You must declare if you or a covered dependent use tobacco products. If you are satisfied with your current medical plan choices, you will need to re-enroll or you will be defaulted into the Open Access Plan. This is an active enrollment, so you must re-enroll to retain your choices. If you will be covering any dependents, you will need to gather the following for each: Social Security numbers, date of birth, birth certificates for newly added dependent children, marriage certificate or certificate of registration and declaration of an informal marriage for newly added legal spouse.
Now that you know what's changing and what you need to enroll, let's go over choices in more details. You have three medical plan options: the Cigna Limited Network Plan, the Cigna Open Access Plan, and the Consumer-Driven Health Plan. Each plan has unique characteristics to fit individual needs.
The Cigna Limited Network Plan is similar to an HMO with copayments. There is a $100 individual and $300 family deductible for medical services. The Cigna Limited Network Plan also includes pharmacy benefits. There are 4 tiers of prescriptions. There is a $100 individual or $300 family deductible. All of your medical care comes from one of 4 IPAs: Cigna Kelsey Care, the Mayor Healthcare Group IPA, and Renaissance IPA. Although the IPAs include differing providers and referral processes, the benefits are exactly the same in each. If you choose the Cigna Limited Network Plan, you will need to select one of these IPAs. If you are a current member of the Cigna Limited Network Plan and intend to remain in that plan, you must re-enroll. You may switch from one IPA to the other effective the first of the month following your change. Family members may be in different IPAs. There is one change to the Cigna Limited Plan. Emergency room visits increase from $200 to $300. Urgent care visits remain $60, and there are locations all across the city. Download the mycigna.com app for your phone for instant access when you need it, or call 1-800-997-1406. Using an urgent care clinic can save you time and money. There are no plan changes to the Cigna Open Access Plan, which is most like a PPO, but with in-network benefits only. Even so, you have access to more than 572,000 Cigna providers without the need for referral. Emergency services are the only services available out of network. There are no plan changes to the Cigna Consumer-Driven Health Plan, or CDHP. The plan includes the same spacious network as the Open Access Plan, but also allows for you to go out of network at higher deductibles and co-insurance percentage. Once you've met your deductible, you'll pay a 20% co-insurance in network and 40% co-insurance out of network. This plan has the lowest monthly contribution option. but the lower contribution can be offset by more money out of your pocket at time of service. The Cigna Open Access Plan also includes a 4-tier prescription drug plan. The co-insurance for all tiers is 20% after the plan deductible. A health reimbursement account, or HRA, is also included with this plan. The city pays $500 for one person or $1,000 for a family into your HRA. That money will be used first to pay eligible health plan expenses. After you used up your HRA, you'll be responsible for the remainder of your deductible. Continue watching for some examples of how the CDHP and HRA work together. Meet Kevin. He's enrolled in the CDHP as employee only. Kevin is generally healthy and gets his Wellman exam each year. As part of the CDHP, he receives $500 in his health reimbursement account, which means he doesn't pay out of pocket for the first $500 of his medical expenses. Kevin's deductible is $1,500, and the most he will pay out of pocket in a year is $5,000. This year, Kevin got his annual exam, which is a preventative service and is provided at no cost to him. He had one visit to an urgent care clinic, which cost $100, and was paid for out of his HRA, leaving him with $400 in the account. A visit to his PCP cost $160. Kevin paid nothing, and the remaining balance in his HRA at the end of the year was $240. This amount will automatically roll over into the next plan year. Meet Mr. and Mrs. Smith. The Smiths have family coverage in the CDHP, and they all get their annual exams. Mrs. Smith has high cholesterol and severe low back pain. As part of the CDHP, the Smiths receive $1,000 in their health care reimbursement account. That means the first $1,000 of their medical expenses will be paid out of the HRA. The deductible for the family is $3,000, and the most they will pay out of pocket for the year is $5,000 per member, or $10,000 total for the family if they use in-network services. The Smiths all got their yearly exams this year, which is a preventative service and is provided at no cost to them. Mrs. Smith visited the chiropractor 3 times for her back pain, which cost $350 and was paid for out of the HRA. Mr. Smith had a minor emergency and paid a visit to an urgent care clinic. The cost was $90 and paid out of the HRA, which then had $560 remaining. Mr. Smith took little Hannah to the ER for stitches. The total cost was $1,100. $560 was paid out of the HRA, and the Smiths paid $540. In addition, the Smiths made 4 office visits to their PCPs, which cost them a total of $350. Their total was $3,640 for medical expenses this year, but only paid $890 out of pocket. The Smiths also elected to put $1,000 in the Healthcare Flexible Spending Account, which is a good combination for the CDHP and HRA. It helped them regulate their medical expenses while saving tax dollars, and they used the HFSA debit card, which made it a snap to be reimbursed. If you earn 500 wellness points by March 31st, then you are eligible for the discounted medical plan contributions. Your rates will stay the same as last year. For employees who don't earn 500 wellness points, the rates are $25 more per month. And if you are a tobacco user, you'll pay another $25 a month on top of that. For a closer look at your contributions, visit the Open Enrollment website at houstontx.gov/OE. There are also a few changes to the pharmacy network this year. We are adding Walgreens and Walmart and removing CVS. If you have active prescriptions with CVS, you can use Cigna Quick Switch to transfer those prescriptions. As an added convenience, you can fill your 90-day prescriptions through Walmart retail locations. You will pay the 30-day copayment times 3. It's important that you continue to improve your health, and now we've made it easier and cheaper by offering free generic medications for 2 prevalent conditions. In 2013, we began offering free diabetic supplies and medications through Cigna Home Delivery. This year, we are adding generic cholesterol medications. Find out how to sign up for Cigna Home Delivery at mycigna.com or by calling 1-800-285-4812.
In addition to the medical plans, you have 2 choices for dental: a standalone vision plan and several supplemental insurance plans. You also have the free employee assistance program, which provides access to a network of professionals to help you through difficult times, work-life balance, and more. I'll guide you through an overview of the plan details.
You have two choices for your dental plan: a dental health maintenance organization, DHMO, and the dental indemnity plan. The DHMO has a network of dentists and orthodontists like an HMO. Your dental services are provided with fixed co-payments. You must choose a primary care dentist, and you must live in the service area. There is no maximum annual limit, no deductibles, and no claim forms with the DHMO plan. The dental indemnity plan lets you receive dental services from the provider of your choice anywhere in the United States. You do not need to choose a primary care dentist. You pay a percentage of the charges for services at the time of service. Then you must file a claim for reimbursement. Some services require a deductible. By using in-network dentists, you can help reduce your out-of-pocket expenses. These are dentists that the plan contracts with for lower service rates. This plan includes a $50 individual and a $150 family deductible. The maximum annual benefit is $1,500 per individual. Here are your bi-weekly dental contributions. These rates and benefits remain the same for the fourth year in a row. For a detailed look at your contributions, visit the Open Enrollment website at houstontx.gov/OE. Added last year, the city now offers a standalone vision plan. Block Vision is the administrator of this plan, which includes a list of participating providers. This plan replaces the limited vision benefit in the Cigna medical plan. There are no deductibles and no claim forms unless you use a non-network provider. You will have to pay for those services up front and be reimbursed if you do not choose a provider from the list. The plan has 4 tiers like the medical plans. You can get coverage for you and all of your eligible dependents. Also, retirees who have a City Cigna plan have the option of participating in this plan. The plan includes a yearly eye exam, yearly eyewear coverage, free lenses, a $150 retail spending allowance for frames, and a one-time allowance of $300 to use towards the cost of LASIK. Here are your bi-weekly vision contributions. These rates are the same as last year. For a more detailed look at your contributions, visit the Open Enrollment website at houstontx.gov/OE. Last year, the Employee Assistance Program was expanded to include access to more than 2,000 mental health providers across the city. Access to this service is available 24 hours a day, 7 days a week, 365 days a year. EAP is available to employees, retirees, and dependents, and you do not need to enroll for this free benefit. Just call the toll-free number at 855-378-7485. The phones are answered by licensed counselors. These services are available at no cost to you, and you can have up to 6 visits per issue. EAP can help with a variety of issues. They provide confidential counseling and legal assistance for divorce, debt, civil actions, and more. They can also help with financial information like credit cards, tax questions, and retirement planning. In addition, EAP gives you access to work-life resources such as helping you find child care referrals, planning for college, finding home repair professionals, and a whole lot more. Supplemental insurance is a benefit provided to active employees only. This insurance gives you protection against the unexpected. There are 3 plans available: Hospital Indemnity Plan, Accident Disability Plan, and Cancer Protection Plan. Hospital Indemnity pays you a daily cash benefit while you or a covered dependent are hospitalized. This money can be used for expenses, even if they are not medical expenses. This plan also offers an annual wellness benefit. The Accident and/or Disability Plan provides a benefit if you or a covered dependent are injured or becomes disabled due to an accident covered by the plan. This payment is in addition to your city medical benefits and can be used for events such as an emergency room use, initial hospitalization, hospital confinement, follow-up visits to the doctor, or other expenses unrelated to medical care, like your mortgage or groceries. This plan also offers an annual wellness benefit. The Personal Cancer Protection Plan provides supplemental insurance for you or a covered dependent diagnosed with cancer. A benefit is paid for most cancer treatments and inpatient care. Benefits are paid directly to you. You may use it to pay for medical, travel, or other expenses. This plan also offers an annual wellness benefit.
The next benefit that I'll review is the Healthcare Flexible Spending Account, or HFSA. This voluntary pre-tax benefit can save you money by reducing taxable income. Let's take a look at what's new this year and how the HFSA works.
With the Aflac Now card, it's easy to use your HFSA. Simply estimate how much you and your family spend on medical services, prescriptions, and other eligible expenses to determine how much you want to contribute. This amount will be deducted before taxes in 24 equal amounts. Use your Aflac Now card to pay for these expenses for instant reimbursement. You must incur expenses up to the total amount of your contribution by April 30th and file claims for reimbursement by July 29th, or you will forfeit anything over $500. Due to new regulations, you can roll over up to $500 into the next plan year. Rollover is automatic. You won't need to complete a form. If for some reason you cannot use your Aflac Now card, then you will need to file a claim for reimbursement. The good news: the total amount of your election is available on May 1st. Your contributions will be deducted biweekly for the remainder of the plan year. When considering the HFSA, remember that you must re-enroll each year. The maximum that you can contribute is $2,500. And remember that if you don't spend your HFSA by April 30th, you will only be able to roll over $500, and anything else will be forfeited. In addition to your co-payments, co-insurance, and deductibles, qualifying expenses include everything that you can deduct from your income tax, according to Internal Revenue Code 213. But remember, over-the-counter medications without a prescription are not eligible for reimbursement without a prescription. Some examples of eligible expenses include chiropractic care, contact lenses and solutions, diabetic supplies, eyeglasses and exams, hearing aids, physical therapy, smoking cessation programs, and speech therapy.
Now that you've got the basics on what you can do during open enrollment, we'll go over who's eligible and how to enroll. Let's find out how to select your choices.
Eligible dependents include your legal spouse from a formal or informal marriage. Common law marriages require legal documentation. Your children to age 26, stepchildren or grandchildren to age 26 who live with you. Children with the pending adoption to age 26, your disabled dependents over age 26 who were covered under the plan before they turned 26, and any children from whom you have a legal parent-child relationship. In all situations, the plan's eligibility rules and necessary documents apply. Enroll online at houstontx.gov/OE. Just click on Enroll Now. Choice Links is an online enrollment and benefit update tool that walks you step by step through the enrollment process. You can enroll in benefits now during this open enrollment period, or make changes later on due to life events like marriage, divorce, birth, and more. If you add new dependents, you will have 30 days following open enrollment to provide the necessary documentation, or those dependents will not have coverage. Documents include marriage and birth certificates. The enrollment period begins Sunday, March 16th, and ends Tuesday, April 15th. Remember, this is an active enrollment, and you must select a medical plan, or you will be automatically enrolled in the Open Access Plan. As a benefit, you receive a basic life insurance of 1 times your salary with no cost to you. You may elect to increase your life insurance for up to 4 times your salary. You will be required to add beneficiaries on Choice Links. Money will not be paid out to a minor. If you choose a minor, they will not receive any benefits until they reach the age of 18. If your life situation changes at any time, marriage, divorce, or death, you should update your beneficiary as soon as possible.
Well, that about sums it up. Now you have a pretty good idea of what's available. And remember, you can find fact sheets, comparison charts, plan summaries, and other tools on the Open Enrollment website. And if you need assistance, contact the Benefits Division of Human Resources, and we'll be happy to help.